Спасибо. Hello, dear colleagues. My name is Mynzhylky Berdikhojayev, Almaty, Kazakhstan. With my assistant number 1, Devlet Suyumbetov, and the assistant number 2, Makhambetkhan Shaykhmet Makhambetkhan. We are from Almaty, Kazakhstan country, Central Asian region. This is a national hospital of the Presidential Affairs Administration, Republic of Kazakhstan. And we have this patient with multiple aneurysms. Patient had a history of family history of aneurysms. The sister of the patient died this year, several months ago, from the aneurysmal subarachnoid hemorrhage. And this patient also had a ventricular subarachnoid hemorrhage, and on MR angiography, multiple aneurysms were found. And we prepared the patient for the procedure. Short introducer sheets, 8 French, 7 French Fubuki. Fubuki 8 French, 7 French. And now we did angiography on the right carotid territory, which is looked like a little bit abnormal. It's like fibromuscular dysplasia or something like this. This is creation of the aneurysm. First, it's extracranial, that's why we will follow that segment. Patient has good PCOM on the right side, and on the left side, the patient has paraophthalmic aneurysm, nearly 4 millimeter. Which the family is and this aneurysm 7.4 millimeter. This was the cause of the subarachnoid ventricular bleeding. The main bleeding 1 month ago, and now it's look like it's growing aneurysm. There is a contrast stagnation, and it's look like dissecting aneurysm. The aortic arch is specific. Right common carotid, left common carotid, then left subclavian, and after that right subclavian is coming. That's why a little bit complex catheterization. And let's do it. Кімге мақсатқа ешкет қалмаса Талғатқа звондап Leo Baby сұратсыншы ауыстыруға. Yes, and unfortunately this is September 27, and most of the products on the shelf already finished, and for the assistance we have no Leo Baby, we have no Elvis Evo, and this is just September 27th. Екі жарым 25 болса болады, 18 болса болады. Usually in this aortic arch, yes, it's subclavian, and the right subclavian is coming very late. Okay. Yeah, 3D also. Okay, let's do 3D angiography, and then we can decide. Because of the slow flow, we need to identify the exact location of the aneurysm. And it was ruptured one. Yes, yesterday I have been to Tashkent and just arrived from Uzbekistan. Morning flight, Uzbek Airlines. And from airport I directly came to the hospital. Stop. Okay. Yes, for today we planned 5 patients, but 2 of them already treated. One maybe for the control angio and one with slight recanalization, but patient at the same time has a meningioma. That's why we will plan to do control angio because of problem with the mini stents. I think we will finish that with meningioma. And finally, 4 patients. Yes, it's a pike aneurysm. Thank you, Maksat. Maksat is doing this. Yes, the artery is coming from the neck region. I think it's possible just coil it like this, 87, 18, 87, right? Gamma штравер, gamma и чихайблок. И баллон Eclipse аштыра салыныр. Yes, I think in this case we will do stage treatment. The first stage we can place coils, and at the second stage it's better to place FD stent. There is a aneurysm on at the daughter sac. It's like okay. Let's check it. Let's check it. 1 second. 1 second. Yeah. Бұрмайқы. 90 градус жасайсаш. Өйткені ана неге кіру керек еще внутренний соны. Или внутренний соны кейінге алдыра саламыз. It's 85 left. This part looks like small blip near the neck. But maybe if we occlude it like this, the blip will be occluded. Cranial 6 is better. Yes, it's a cranial 6. Eclipse одна просветная бар, аш пересалындар. Let's do it like this. It's for the navigation. Because of the ruptured aneurysm, yes, there are 2 options. Option 1, we can coil it, and option 2, сәл бұрылған дұрыс сияқты. Бері сал.
Зоя фен қосшы.
Yes, it was a nice comment during the 3C meeting this year. We had a basilar aneurysm, and during the treatment it was some kind of complication, and because of the shortening of the material we had that complication, and the suggestion was maybe it's better to wait for the availability of material, but for this patient it's impossible to wait. Бүйтесің, мынаны жалғап бересің. Yes, Sheikh is microsurgeon. He's doing very nice microsurgery, but unfortunately, time to time, it's a small department, and he need to also do selective angiography and complex treatment. Yes, it's a specific of Kazakh medicine. You couldn't do only microsurgery or endovascular, you need to do both. And yes, if you are working in a big center like Charité or Barrow Institute, then you can do only endovascular or only microsurgery. But the places like ours, yes, like ours, time to time you need to do spine, brain, pituitary tumors, and etc. Yeah? Мен микрофонға айтпай қойыншы, Мақсат Габич. Внутренний сонный аневризма дайындайсыңдар. Келесі, внутренний сонный аневризма. Шериханыш, внутренний сонный аневризма бар ғой, жаңа сөйлескен. Соны. Yes, because of live streaming, I'm trying to avoid to call the names of the patients. It's very important. Okay. Balloon in this case for the security, and also a patient has a ICA aneurysm. Because of the ruptured case, I think it's better to do both. Sheikh and Marat Sarshayev already visited the Barrow Institute in Arizona 1 year ago, huh?
Yes.
1 year ago. Yes, and last summer. I think it was very nice time. They stayed 1 month and really enjoyed the United States and Barrow. Unfortunately, I didn't visit Barrow yet, but I have many friends in Barrow. Ashutosh from Barrow Institute, and we met on several conferences. Albuquerque, yes, and Professor Lawton from Barrow also. And Sheikh Ahmed was with Afzal also did a fellowship in Banten Fujita Health University Hospital with Professor Yoko Kato. And now they are practicing endoscopic microvascular decompression. It's very nice technique without wide opening the skull. Very secured and very safe procedure. And I hope our patients also enjoying the treatment. Предыдущий раз. Smart. Жора было низко. Осы. Назад. Бұдан кейін. Осын. Smart mask. For me, in this case, better in one session to place several coils and FD, in my opinion. And for the IC aneurysm, we can go next time. Let's see. We'll do as much as possible, and for every patient is better to do the individual treatment also as much as possible. Yes, eclipse balloon is quite stiff balloon, and we need a little bit more support. And you see, when you try to push the eclipse, the guiding catheter is kicking down, pushing down. It's very stiff. It's very stiff device. Okay. It's a quite stiff device. Okay. Yes, we can give zoom. Yes, as much as possible, maximum zoom. And now it looks like the neck of the aneurysm is not so wide, and it could be a little bit problem to go inside the aneurysm because of the narrow neck. But now we are inside the aneurysm. Okay, I will try to do it like this. And the first coil will be 515 or 520. Yes, the size of the aneurysm is nearly 7, but for me 5 is better. 5 millimeter is better. Yes, yes, and for me this aneurysm look like partially thrombosed. Okay. Okay. 5 millimeter. Не бересешь? Кастратор. Just a second. Biz önceden бересің? Екеуін бересің? 517 Optima. Я Optima мен жұмыс істей берейік. As at the first session we can place coils, and at the second session it's possible to place FD. Okay, let's see. Maybe we need to do at one session. We shortened from the quotation, and for this year it might be very limited number of cases. And назад. Асыпа, да. Yes, Давлет after vacation, and it's very specific when doctor came from the vacation. Так, екіншісін 5-17 аша бер. I asked for both coils 517 Optima. The Jojo, still. That's the first 517. I think 2517 will be okay. Отделе. Жоқ, нормально болады. Может, 2,517 салып, сосын потокқа саламыз. Қазір. 4 мм сылтар ғой. Turcham. Yes, let's see. Yes, it's a specific of public medicine. You should work with material, available material. Nearly 10 years ago, we discussed with Kublai, less than 10 years ago, in Istanbul, when in a university hospital, not all the material were available. And now we are with the same situation. Okay. Balloon in this case for the security, for any force majeure situation, balloon is available and we can inflate it if it's needed. It's like a parachute. Так, 4 сал жеріміз. 4-те 10 бері сал. Okay. It wasn't detached.
Зоя қайтан алып кел.
Жоқ, отделилось. Просто не до конца. It's okay. Yes, with the electrically detachable system, it's possible scenario when it's not detaching. Так, 4-те 10 ғой, да? 4x10, next coil. Till 3 mm, all coils are complex. 3 mm, half of them is helical, half is complex. Үште 10, үште 8 болады. Yes, maybe we will place this coil and then we can place flow diverter stand. Yes.
4-8 бар.
Yes, the down part of the aneurysm. Специально свой понял. 3-те 10, 3-те 8 не бар. Бери бер, 3-те 8. Okay. To prevent the coil movement, usually it's better to do this maneuver. 3-те 8. Also, the next coil will be microplex 3x8. Let's check it. Yes, the problem is we are short from quotation and till the next treatment, patient may rupture, and that's why maybe better to place stent now. Так, бір рет вперед, бір рет вперед. Жоқ, осының өзін бір рет вперед. Стоп. Окей. Yes, it's a complex, and the problem is patient couldn't buy anything if we short from tender, and then the only way for the patient to wait next tender. Okay, the whole coil is inside the previous mesh. Так, үште 10 бар ма? Үште 8, үште 10 не бар? Берер. Yes, next is Optima complex 3x10. Yes, in many places in regional hospitals, usually colleagues place several coils, usually 2-3 coils, and then send the patient back home, and it could be done several times. Yes, in complex economical situation, maybe it's an option, but with the shortage of quotation, I think it's not the best approach, huh? Okay. Now place coils at the orifice side. Okay. There is a place for a couple of coils, but I think we can place an FD. We can go outside. Қажеге келді? Yes. It was a frontal part of the aneurysm was occluded. Yes. There is the office part. Maybe there is a black, huh? No, diverticular side, huh? Or it's look like artery. Headway 21 ашып бересіз? Headway 21. Okay. It's an artery. Now we will take headway 21 and we will place silk vista. Yeah, 5000 just.
5000 гепарин.
5000 units of heparin. Коррекция.
Оно в шейном сегменте, оно фузиформное. Потом.
О, наблюдение. Сейчас another 2-3 aneurysms, huh? Okay. On жағында, сол жағында? Сол жағында. Okay. There are 3 aneurysms on the left carotid territory. Let's see. Kas correct? Okay. I brought my balloon back. Söylüyor atırım. Şeyh Mete dürüst söylüyor atırım mı? Sözleri dürüst mü? Silkvis'ten aşıp verirsin. Грамматикасын тексеретін адам жоқ қой.
Разговорная грамматика жоқ па?
Okay. We just joked about the grammar of English, of my English, and Sheikh Ahmed noticed that in speaking, most of the time, no need for grammar, huh? But it's needed, Trotr. It's needed. Grammar is needed everywhere, not only in English. Altı? Хорошо. Келді ма? Yes, we're waiting for the flashing. Smart mask. Келді ма? Yes, and yesterday I worked on new Azurion 3 in Tashkent in Neomed Hospital with my colleague Bunyot Karimov. And surprisingly, dual fluoro like this and 3D angiography were available on Azurion 3. For me, it was a little bit surprising. I thought 3D is not available on Azurion 3. Assistant is arriving. Something like this is better. The Silk Vista flow diverter stent is 4 by 20. The diameter of the artery is nearly 2.3, 2.9, nearly 3 millimeter. And I think it will be okay. Okay. Patient pre-medicated with ticagrelor and verify now is effective. We checked for verify now and everything is okay. Okay. Now we can detach the FD. Usually no problem. Patient has a hypoplastic left vertebral, but it's in place, huh? Okay, stop. Yes, Spica is working and aneurysm secured with coils, and we already placed the flow diverter stent. Minus record. Yes, it's properly opened. Yes, and the proximal part is okay. Yeah. Okay. Yeah, no. Okay. Let's check the left side. Проводник пересел. Как я же баллон қолданылсын. Okay. Just a second. Yes, with the Judkins right, usually it's not problem. But Fubuki is quite soft guiding catheter, and it's also possible. Құлады ма? Лақтыра сал. Қолмен ұстама енді, ұстама қолмен. Жібере сал. Okay. Джекер жық. Just a second. We can take a headway 21. I will just check the territory. Maybe we can finish with this stage. It might be enough for today. The ruptured one was the pica aneurysm. Yes, it might be easy, look like, but let's check it. Yes. Okay, that's one of the options. It's possible to go with the headway. And then we can go back with the balloon. These are two devices. Даже аж пекло. It will work. There is no problem. Yes. Just a second. It's a problem. Okay. It's a problem of Fubuki, huh? Okay, let's place it here, and then we can bring back the guiding. Прекрасно было. Кирилл, не шнашасın, Berdik, işler sistemi sıkıyor. Yes, we are in external carotid territory, and now I can bring my balloon. Balloon is coming. It's very stiff microcatheter, huh? Yes, it's very stiff microcatheter. Okay. Attempt number 3. Yeah? With the Judkins right catheter, usually it takes 5 seconds. Okay. Just a second. This balloon is arrived. Yes. Different story. Huh? Stop. Mm. There is one more aneurysm here. Small aneurysm was here, and maybe something is here. Yes? Okay. Жақсы. Спазм жоқ қой. Böyle kulak kalmasın. Good. Okay, let's measure the diameters. Yes. It's 3x4. Right? It's also the small. Najde aneurysm? Najde mi? It's 3x3. 3x8. Okay. Just a quick. Millimeter aneurysm. There is small aneurysm here. 4.4 millimeter. Okay. Okay, let's place one small coil. Couple of coils in IC aneurysm. Okay. There is another aneurysm on ICA. Okay. I think 2 of these will be too much, huh? 2 of these will be too much. Остросол.
Мне кажется, на жерге тик с первого ора салу керек та, потом следующий этап неге левого шыққа саламыз. Или потом, будет еще. Если или сразу еще келесі этап, келесі.
I hope it will be stable for a couple of months. Yes, there is a 1, 2, 3 aneurysms. Yes. Okay, let's do expert CT. I think you will also agree this part we'll treat next time. Okay, let's wait for expert CT. Okay, expert CT is coming. Okay, CT is clear. This is an aneurysm on the left side. I see this was the coils extent, and brain is clear. We can finish this case, and today video engineer is Roman. Evgeny will come later, video and company. Anesthesiology physician was Asla with the Sultanat anesthesiology nurse and the Zoya operating nurse. Thank you for watching. See you in next 30 minutes. See you. Thank you.